A group of 100 scientists and doctors have written a letter to Prime Minister Liz Truss asking her to pause the COVID-19 vaccine rollout for healthy children. The healthcare workers have told the Prime Minister that, quote, "You have an opportunity to get ahead of the inevitable backlash by pausing the rollout with immediate effect. This would be a risk-free action. Until then, the political risk and health risk of this policy will only escalate." Here to discuss this, I'm joined by Dr. Elizabeth Evans, a retired doctor and co-founder of UK Medical Freedom Alliance, and Professor Angus Dalgleish, I think that's how you pronounce it, yes? The principal of the Institute of Cancer Vaccines and Immunotherapy. And of course, Neil will be joining us as well from Scotland. Dr. Evans, what prompted you to get involved in this letter?
Well, as you said, I co-founded the UK Medical Freedom Alliance in October 2020, and in February 2021 we wrote our first letter about children's vaccines, even before, when the rollout was just happening to elderly people, because we could see where things were going. And we wrote to the MHRA, to government and to the JCVI to say that this would be completely unethical. Even at that point, there were some safety concerns, particularly the lack of any long-term safety data. And we knew that children are not impacted by COVID, so there was going to be no benefit to them. But we were worried. We could see that there was a kind of a mission creep in everything COVID, and we wanted to get ahead of the game. So obviously we didn't hear back from any of the people we wrote to. And then in May, Ros Jones, the retired consultant paediatrician who I was working alongside in Heart, got together a group of doctors to write again, because we could see there were lots of rumours that this was going to in fact be rolled out to under 18s. And we wanted to try to prevent that happening.
Neil, would you like to ask
Dr. Dalgleish, I wonder what has been the uptake so far among the age group in question, the under 18s, 5 to 11s and so on?
Do you want to answer that?
I think for 5 to 11s, it's been very low. It's just under 11%. I think as you go into the next age group, 12 to 16, it's more like 50% or so, and a bit more again in the 16, 17-year-olds.
I want. It's in that context why you think it is that the government keeps pushing and pushing with that younger age group that aren't at risk from the virus, in any particular measurable way. Why does when there is the hesitancy, when there is the disinclination to take it, why does the government keep pushing away at that door that's closed?
I think what we've seen is we've slipped into a complete erosion of core ethical principles in all policies, but particularly from my perspective, from a medical perspective. So we've lost all those core ethical principles that really underpin a civilized society. So, we had safety signals. We now have blaring sirens. But nobody seems to be taking any notice of it. The way that these products have been marketed to the general public has been it's very facetious, it's very superficial, it's been, there's been coercion, there's been a complete underplaying of any risks, a complete overplaying of any benefits, which means that any sort of concept of informed consent, people being able to give informed consent, has been lost. I'm not sure anybody has given fully informed consent to these.
I've been very interested by what, for example, Professor Matthias Desmond at Ghent University has had to say about this idea of a mass formation psychosis, where he says where he argues, amongst other things, that the more absurd the orthodoxy becomes, the more determined some people are to maintain it. You might expect it to go the other way, but in fact, the more absurd it becomes, the more determined are its defenders. And I just wonder sometimes if, I don't know, MPs and the scientific experts are as susceptible to mass formation psychosis as anybody else.
What's really interesting is just before the rollout started in November 2020, the MHRA applied and bought a a software system because they were expecting a high number of adverse events, and they needed, a really super duper system to record them. And yet this has all been recorded, and they release the numbers every week. And we are, not just in the UK, but in Europe, in the US, have completely skyrocketing reports of vaccine injuries and deaths from these COVID jabs. And yet nobody is doing anything about it. So it's like the evidence is there, and nobody is responding in a normal way that would have happened years ago. What do you think, Angus?
Well, I totally agree. I could never understand why you would want to roll out a vaccine to young people with very good immune responses who were not getting ill with it. I mean, if they did, it was no more than a cold. And it seemed to be really bizarre that when pushed, they said, oh, we must do this in order to protect other people. But you don't give vaccines to protect other people. And I do believe that, the majority felt like that, but they were overruled and said, no, we must push it into the children just to be safe, as it were. But they were perfectly safe without having the vaccine. Now, why did I get interested and involved in this? One of the reasons, right at the beginning, I was involved with trying to design perhaps a very good vaccine, because we saw the potential for side effects from using the spike protein. Now, everybody who's made a vaccine has used the whole spike protein, but it contains a large percentage of proteins coded for it that are very similar to our own. So the chances of having side effects were extremely high, but these were completely, utterly ignored. Now, when it was first rolled out, I don't think we were particularly told the truth. There's been a lot of whistleblowers about this, but I tend to take a lot of notice of what I see in my practice as a clinician. You basically take that in. And what I was seeing was young men with terrible cardiac complaints, which ended up being called myocarditis, pericarditis. But their lives were ruined by having a vaccine they clearly did not need.
May I just cut in there, just to give some balance? Because a lot of people sitting at home will say, yes, the vaccine clearly isn't necessary for young children to take, because, as you say, they've got a good immune system and they're not at risk of death or any harm, really, from this particular virus. But is it actively going to harm them? Is it actively going to harm children to take such a vaccine? Because it seems it should be perhaps a choice for the parents.
I think, but again, with medicine, it has to be an informed choice, and we have a very strict ethical code, which is that all medical treatment has to be proportionate and necessary, because no medication is 100% safe. And for the person, even if it happens only in 1 in 1,000 or 1 in a million, for that person, that side effect happens 100%. So, for them, it doesn't matter that it's rare. And if you've got no benefit and the risks to that person outweigh the benefit, then it is not appropriate to give a medication. And I think, the Hippocratic Oath is what we have to come back to. First, do no harm. And that is what doctors are instructed to do. So it can't just be up to the parent, in the sense that we shouldn't be offering something to a group where the risks outweigh the benefits.
If I could just comment on that, it was calculated that you'd have to give 1 million vaccines to children to prevent one of them going to hospital. I mean, what kind of odds is that, when you don't know what the side effect profile is going to be in those children? And we do know that there are a lot of reports of adverse events in children, and even in young adults too. So I think that that's why it has to be reassessed properly, and all the side effects taken into serious consideration, because I think what is out there at the moment, there's been some very good papers published recently. There was a big review of COVID-19 vaccinations in an Australian group who've just published, and they come to the conclusion at the end of the day it is not justifiable or worth it on a risk-balance ratio from the side effects that they collected, and they've collected pages and pages. And then we've had our own Dr. Maltruta, Asim Maltruta, a cardiologist, write in an insulin journal, interestingly, about the side effects of the vaccine, which he promoted earlier on. He was the first, go out and get it. Now he's completely changed his mind because he says the side effects he's seen, and it is the cardiologists that have seen most of them, do not justify continuing it.
Does it raise the spectre of legal action? You know, as you say, Dr. Evans, you mentioned the Hippocratic Oath, and where it would appear now that the risk to children is just it's so immeasurably small, vanishingly small, that by putting that procedure into those people who are at no risk from the virus, when we now know that there are measurable risks from the products that are going into people's arms, is that not a prima facie breach of the Hippocratic Oath about first doing no harm? And therefore, are people not putting themselves at risk of a malpractice allegation?
Yeah, certainly. I think, you know, if you look back in history, we had the flu vaccine in the last pandemic in 2009, Pandemrix, which caused a number of cases of narcolepsy in children in Europe. There's just over 1,000 cases. You know, eventually that was pulled from market. People now, so what are we now, 10, 15 years later, are still, you know, trying to get payouts. I mean, these legal processes take so long. There is a scheme, a compensation scheme that the government run for people who are injured, but it's, you know, £120,000. You have to prove yourself to be 60% disabled. And there's a really long and arduous process to get any sort of compensation at all. So certainly in the future, there could be legal cases. But at the moment, I would hope that doctors would start to return to this, to patient-centred medicine, get away from this one-size-fits-all and following a protocol and government guidelines. You know, the duty of care of a doctor is to the patient in the room in front of them. And they have to look at that individual patient and the risks and the benefits of the treatment for that patient, and take the patient's wishes into account and be their advocate if they don't want it. So, you know, there's a number of people, adults, who were trying to get exemptions from the vaccine. They didn't want it, and their doctors said they weren't able to do that. That is not the type of medicine that we should be practicing, and that is not ethical.
From the beginning, were individual doctors in a position where they could refuse to administer these products on the basis that their Hippocratic Oath, bound them because there wasn't the long-term data, and if they had concerns, could they refuse?
Yes, Neil said, were doctors in a position to be able to refuse to give a vaccine? Were they allowed to refuse to give a vaccine if the patient didn't want it?
I think it's been very difficult. I think anyone who's gone against the narrative has faced, serious pressure, possible, investigation by their employers, reporting to the GMC. There was very much the feeling that it was just, you don't ask questions, you just do what you're told. That's what I'm picking up from what we've heard from doctors. So they could have done, but the ones who stood up, really, really suffered for it.
Angus, would you like anything to add before we finish the discussion? How would you like the government to respond to this letter? Are you positive? Do you feel positive about that the new administration might be receptive to such a letter?
It's a very good point, and I think they have to be. They've got the chance to say that mistakes were made we didn't notice before. They've got some very good leads. Denmark have banned all the vaccines for people under 18, and then within no time at all it is under 50. And I can see that they're going to get rid of all vaccinations, for COVID vaccinations, for the whole population, and that will include boosters. And that's another thing. It's very hard to justify boosters on the current narrative, yet we keep being told, have another one because it declines, be safe. Well, there's a reason why responses decline, is because they're not needed all the time. Once you have been vaccinated well, you actually automatically make a good response when you're exposed to the agent. You don't have to have booster after booster after booster. And this is what other people are seeing now. And I think our new incoming government and Health Secretary has a wonderful opportunity to stop the damage being continued to be roller coasted on, which is what I'm fearing and what I'm seeing. I'm hearing people saying, oh, I had the booster and then, oh, by the way, I had this, that and the other. And they don't seem to realise that the more boosters you have, the more side effects that we're beginning to see.
Well, I'm sure for most people who are vulnerable to COVID, the vaccine has helped them and has clearly benefited many people in the world. So I must say that. But that was a fascinating discussion, and I hope that your letter is read by the new Prime Minister, although she's got a huge amount on her plate. I imagine she might have to get one of her officials to reply on her behalf. Anyway, thank you very much. That was Dr. Elizabeth Evans, a retired doctor and co-founder of UK Medical Freedom Alliance, and Professor Angus Dalgleish, the principal of the Institute of Cancer Vaccines and Immunotherapy. And Neil, of course, will be saying goodbye to him for a little bit